Thank you, Mr. Chairman. And thanks so much for being here, Ms. Tavener. Ms. Tavener, as a former project manager and management consultant, I'm perplexed as to the genesis of some of these problems with respect to the website and the broader rollout. And so I'd like to explore with you maybe what the problems were. Let me step back and talk about the issue of openness and transparency. It was CBS News that last week reported that as we went into the summer of 2012, there are certain key regulations that contractors were waiting on. They had to be issued in order for them to continue to do their work, put forward requirements for their IT systems, and put together healthcare.gov. Could we put up the slide, please, to illustrate some of the regulatory issuance pattern? We see that over the couple of years preceding the summer of 2012, we had 109 proposed regulations put forward by HHS. Then starting in the summer before the presidential election, we had 0 regulations all the way through the election. And since that time period, we've seen 60 regulations put forward by HHS. So my question to you, Ms. Tavener, is that, and CBS News did indicate that some of the rules were ready to go back in June or July, according to one insider that they quoted in their report. So why did HHS stop issuing regulations as the person on the inside, the so-called quarterback of this website?
So the regulation process, I don't know that at any point we've stopped issuing regulations. As you can see, it's been a continuous process. The regulations, we were basically—
But there was a gap, you see, right up there.
I do see that gap.
How do you account for that?
A 2-month gap, and I don't know that that would be unusual. If we were to go back, and I'm happy to go back and map the last 4 years, we've probably had 2-month gaps at other intervals.
So we think CBS News missed that.
No, I don't know what CBS News did. I'm just telling you.
Right.
We've had a continuous regulatory process going on. We have worked with the public. There's obviously a lot of back and forth between us and OMB in a regulation process. It's not unusual for a reg to take 2 months, 4 months, or longer.
So you can assure us that partisan politics played absolutely no role in that delay?
I think, again, the regulatory process was continuous. At no point were we not either working on white papers, proposed regs, or just getting the work done.
Well, as you know, as you've heard here today, there are real consequences to our constituents for the failures and shortcomings of this website. You've acknowledged that.
Let me ask you, let me talk to you about the website.
Well, I've got a limited time, so I'm going to move forward and talk about
one of me to explain the problems with the website. Do you want me to explain the problems with the website?
I'll allow you to submit supplemental material.
First of all, I'd just say it's not a website. It's an insurance program, okay? And sometimes we think it's like a website.
Right.
Website just like looks at things. This is a complicated program tied to 34 states, including very individualized Medicaid programs. People need to understand.
Thank you, Ms. Tavener. I'd like to go back to healthcare.gov, which is the website associated with signing up for required government-sanctioned health care. And Marvin, one of my constituents, writes on behalf of his wife, who is told by her insurer that due to health care reform effective 1/1/14, the policy in the name of said citizen has been or will be terminated as of January 1, 2014. When can she sign up for her health care, Ms. Tavener?
Does it go on to talk about other policies, or it just says she's canceled and that's it?
Goes on and says she's canceled.
She's eligible and she can sign up for new plans with the issuers.
She needs to sign up through the website.
She can sign up through the website, or she can go to that individual issuer.
Time has expired. Mr.